Welcome to the Free Marketeers, the official podcast of the Free Market Foundation.
Hello, everyone. This is Mpia Dlamini speaking to you, and it's my first time hosting. Thank you guys for that. So I'm with Chris Hetting and Martin van Staden of the Free Market Foundation, and this is the Free Marketeers. So this week, I thought we'd start by talking about Chris's latest article, which was really interesting. It was on City Press. It was the title was "South Africa Needs a Radical Solution: Capitalism." So, Chris, maybe you could just talk more about that and tell us the main points you made in the article.
Sure. I started with the premise that running throughout South Africa's history, colonialism, apartheid, these different social systems, even now, with big government, the premise seems to be government is at the center, of our lives, and they do things for us and they control things through all these various methods, NHI, social welfare, EWC. At the center of all of it is government and the presumption that government can solve our problems for us. So that's our history, that's the backdrop, that's the context. And opposed to that, you have capitalism, which is the only system of individualism, free markets, individual rights. And I think that stands in stark contrast to our history. So in the article, I try to make the point philosophically that we've always been dominated by government in its various forms and the state. You can, whichever political party it might be, even now, most of them, they're sort of at their base, it seems to be control of the individual, not letting the individual be free. I think whenever government introduces new laws, parliamentarians, politicians, the burden of proof rests on them to justify how much of our freedom, they can take, kind of thing. It seems to be that no one looks at it from that side. It's always just, we're doing this for you, but we don't consider what's getting taken away from us. So I think that's broadly, my conceptualization of the article. Then I tried to make some, specific concrete points, like I mentioned, the NHI, expropriation. These are just the real world effects of that philosophical premise that the state is at the center, not the individual.
So it's interesting you say it, especially the historical context, because if you listen to some people, some of my Facebook friends especially, they'll tell you that South Africa has been capitalist, colonialism was capitalist, apartheid was capitalist, and now we need something completely different.
Right. As soon as I've also heard that argument, but I go back to the force versus voluntary distinction. And if there's force, in an economic system or social system, it's not capitalist. Because capitalism rests on voluntarism. It's about us trading with each other, and interacting with each other on a win-win basis. It's not a zero-sum game. If I don't want to trade with a business, or if I don't want to talk to someone, kind of thing, no one's holding a gun to my head. It's always up to me to decide if I want to.
And then it's bizarre that there are some people who actively think that is what apartheid was. When I shared your article and the quotes we made from it on our Facebook page, some people are saying, no, you can say that about socialism and communism, but colonialism and apartheid, they were different. They weren't so bad. And it's like, people were taken out of their property and they were put somewhere where they didn't want to be. And there were laws on the book saying that you can't sell certain things to black people if you're white. If you are black, you can't buy certain things from white people, and so forth. It's completely absurd to say that apartheid resembled anything like capitalism. But of course, they use a very simplistic view of capitalism, and that's that the preponderance of property in South Africa was privately owned. And I mean, that's a very silly way to go about defining what the political system of the day is. I mean, the point is the property was owned, but at every corner you had a law saying you can't do this and this and this with your property, and you must do this and this. That's not a system of individual rights as what capitalism characterizes. So you great quotable article. Good job.
I think especially with apartheid, that it was typified in terms of group identity, and it's funny that progressives nowadays think they're progressive, but actually it's just rehashing some of the past arguments that one group thought they could decide for everyone else how things should run. They thought in terms of, okay, I do what's best for my race group, but it's the same. People think according to lines of race, wealth, income, all these sorts of things, but it all just ends up dividing people into groups. It doesn't focus on individual freedom.
What I would just want to say about that is that apartheid was people who thought that they were representing a group, but we also know that we had a lot of great Afrikaner libertarians, individualists who actually fought against the system. But it's a great article, and something that's more people need to be aware of the history, especially.
Yeah.
And then moving on to this week at the Free Market Foundation, we had a very special event, a special guest. Dawie Roodt was was hosting a talk here at the foundation, which was titled "The Maximum Magnitude of the Mini Budgets." So it personally scared me to see all the charts.
You should get used to it, because every year it gets worse and worse.
Yeah. Welcome to the Free Market Foundation, Piagi.
So, but it was good, because it's even though it's scary, it's good. I think it's good to get informed. So I don't know what you guys think about the presentation, the talk, and maybe you could comment on that.
For me, the biggest thing that stood out was the, government expenditure as a percentage of the GDP, because I guess political commentators and social commentators from all sides, we worry about zero, not even negative growth in the country, but zero growth. It's sort of on a negative scale now. And I think Dawie said it was 29% that government spends of GDP, and that leaves pretty much no scope for the private sector. So the more, I think it's a case of people, we talk about inequality and wealth, but if government is actively involved in that bigger share of the economy, then wealth is fixed. Then they are taking, a big part of it, and that doesn't leave much room for individuals to earn their own wealth.
Yeah. What I found interesting, and I don't know if I have the numbers correct, but he pointed out the discrepancy between public sector and private sector investment, I believe, in capital infrastructure or something.
Yeah.
And there is a massive gap. And of course, the private sector comes in at what I think is about 30%, and government is about at 11%.
Yeah.
And Dawie pointed out, but I don't think he emphasized it enough, but government is always saying it can't just be us who are driving South Africa forward. The private sector need to pull their weight, and they're not, and this is very disappointing, and that's why we're going to regulate them even more. It's absurd. All the progress we're seeing in South Africa, virtually all of it, is a result of private sector led growth. And please don't misunderstand me. I'm not giving credit to big businesses. I mean, there are some terrible big businesses out there who are just clamoring for favors from government. But if you look at small and medium enterprises, these people are the big employers in South Africa. They are really contributing most of the taxes. As Dawie showed, personal income taxes are the biggest contributor to the national fiscus, and not corporate taxes, which comes in, I believe, about third or fourth. So that to me tells a very clear story that you can say middle class businesses are really driving South Africa forward, and all the government can do is just punish them for that, which is it's absurd and sickening.
Well, you can think of it in terms of a relationship. It's this abusive partnership where business keeps getting told by government how bad business is, but they keep staying. So you're sort of damned if you do, damned if you don't kind of thing. Business sort of, I mean, they can and they ought to stand up for themselves, morally speaking, but I think at present they're just sort of caught between a rock and a hard place.
Yeah, so you get taxed and regulated to the hilt and still manage to invest 3 times more than what government
and it's still
does.
Not enough, yeah.
And it's still not enough. No. Yeah, they say you're on an investment strike.
Yes,
yeah, but it's interesting. So let's talk about the national minimum wage now. I think one of the articles from the radicals here at the foundation came out, the national minimum wage today.
Yeah, don't be humble. It was in Piagi's article.
Yeah, you don't have to speak in the third person.
Yeah.
So tell us, Mpiagi, what did you look at any data specifically from any specific sources? What did you find about the minimum wage, the national minimum wage coming up? Do you think it's going to have any effect on any groups in society? Maybe the youth, we know about the 10 million unemployed. What's it gonna, is it gonna help them as the government has touted it all the time?
Yeah, even though I was really hoping that I was going to find that the minimum wage is going to be positive as some academics advocates seem to believe, but unfortunately, no. Yeah, it's just going to be what we already know from economics, like economic knowledge that has been accumulated over time. That is it looks like it is already having some bad effects. Like there are some preliminary indications of job losses among the youth, the people who are 15 to 24 years old, and people who are matrics, people who only have a matric, who don't have a tertiary qualification. So that's it's important to remember that these are preliminary indications, and they're just the things that have happened since the announcement was made last year in February. But they are, if you want to more there are indications that there have already been job losses because of the minimum wage. Of course, to do a proper study, you would have to control for other variables and all of that.
Right.
But like it's for me, I think it seems like a remarkable coincidence that you would see such changes that coincide exactly with the period. So
Yeah, well, I mean, you guys are more into the data thing than I am. Obviously, for me, it's a completely simple story. If you want less of something, you increase the price of it, and that is exactly what a minimum wage is. That's exactly what any government intervention actually does at the end of the day. But a minimum wage makes labor more expensive, and if a business is already operating at the margins and there's now a minimum wage, it's not going to employ more people. It's really as simple as that. And especially in South Africa, where I think Dawie Roodt said we have, or he projects, 1.7% growth or 0.7, something like that. But it's,
I think Treasury probably says 1.7 and
Yeah,
Dawie says
yeah.
0.7.
yeah, and I'm still of the opinion that we're probably not growing at all. We're
No.
probably contracting. But I'm not an economist. That's just what I feel looking around what's going on in
Surely.
South Africa, and just my common sense of the policies government have announced and people leaving. But obviously you cannot introduce a minimum wage in this environment. Especially for poor people who want to be entrepreneurs. They can't employ someone at some arbitrarily arrived at number if that is not the price at which they value that labor.
Right.
So if I need someone to sweep my shop, and I can do it myself, but I would rather not, I'm willing to pay 500 Rand a month for that. If I'm not allowed to legally pay that, then I'm not going to employ someone and I'm going to sweep it myself. That means 500 Rand has been taken from someone else.
Yeah.
That's the essence of the minimum wage. I mean, it's ridiculous.
So the kind of analysis I did for the article was look at the proportions of the youth among all people who don't have jobs, or all people who are employed. Sorry, and then you find that the youth they tend to be more young people in the 3,500 rands or less category, and then you look at matrix, and then you see that there are more matrix in the 3,500 rands or less category compared to people with tertiary qualifications. And then the next step is just to see if what the unemployment, how the employment rate has changed between the time that there's been this agreement hanging over businesses' head.
Right.
It hasn't been put into operation yet, but business is already calculating, because if you're a small business owner, you calculate based on the information that you have available to you. So I think it's, we are probably going to see even worse when it's implemented. We're already seeing job losses, so we'll probably see even worse. And it's, I guess we'll see how it goes.
Yeah.
And then I heard that, Chris, you mentioned that there was something interesting said recently about the NHI.
So Dr. Aaron Motsoaledi, Minister of Health, he said, was it yesterday or 2 days ago, that due to after the budget, the mini budget announced last week by Tito Mboweni, the long and the short of it, there's no money for the NHI, so the planned rollout is on pause, which I found interesting, because I don't know where this money is going to appear from anyway. So I would just say he should postpone it indefinitely, or just abandon the plan. But we know he won't. He's committed to the cause, I think, to the socialized healthcare cause. But at least, I don't know if it's a glimmer of hope, but there's some realism around that things cost money. Regardless of how noble you think a cause is, the big government planners want to spend on welfare and infrastructure and everything, but if you don't get money in, you can't send money out, kind of thing, unless you start printing money, and that's just inflation and all that stuff. So
yeah. I mean, what did Dawie say? There's about a 30 billion Rand deficit in government revenue. So SARS is missing out on 30 billion to cover what they already need to pay for.
Yes.
So it's not like they would like to have 30. They need the 30 to pay what they need to pay for.
Yeah.
And I think last we heard the NHI over the next 5 years had a price tag of about 250-ish billion Rand, and the most hilarious part of all of it is in the white paper for the NHI. They said they draw attention to the Department of Health draws attention to the fact that a lot of people are bringing up this whole cost issue, and they really shouldn't, because we really mean well with this policy, and that's what people really should care about. We want to bring health to poor people, and that's really all that matters. So don't worry about the costs. We'll get the money.
Yeah.
And well, now I'm glad that Motsoaledi sees that no, you're not gonna get the money. And I know he says it's just paused. We'll bring it back at some point.
Yeah.
No, we are not gonna have money for this. At least I would imagine for the next few decades.
No,
I
sure.
mean,
Yeah.
people are leaving South Africa now. Nobody's coming in.
Yeah.
The policies that this government has agreed on, there's a consensus on, are so anti-growth
Yeah.
that any idea of an NHI needs to be shelved until we've adopted like a early 1900s American free enterprise system. Like before that, no, nothing.
I think that's important. If we keep pursuing zero growth policies, i.e. socialism,
Yeah.
whether he wants it or not, the money isn't going to appear magically. Reality has caught up to him now, I think,
Yeah.
and he's acknowledged the facts of the matter. You can't just wish things were different. I think morally speaking, the NHI is also based on the idea that, you know, society has a right to the services of doctors, and that society and government can decide where nurses and doctors should work and who they should care for and that sort of thing. So on both accounts, it's misguided, and now at least one of them is catching up to him.
Yeah.
At least the doctors are one of the most mobile people in the world. So unless you plan to chain all of them to South Africa and say you can't leave and just stop them at the border, there's no way that you can do something like the NHI in South Africa.
Doctors can go anywhere they want.
Yeah.
It's as simple as that. There's no jurisdictional barriers to being a doctor. So if any other place in the world is easier, more conducive for them to go and work at, they will. And I mean, Dr. Chris Archer, who I believe is the chairman of the Practitioners Forum, Medical Practitioners Forum or something, and also a part of the health policy unit of the Free Market Foundation. He's the one who said recently that, listen, if you're going to implement NHI, or was it the demarcation regulations? I think it was NHI. He said our members, which I believe is something like 20,000, maybe hundreds of thousands, are going to leave. It's as simple as that. And I think that probably contributed somewhat to Motsoaledi rolling this back.
Yeah.
But I think it's worth noting that medicine in South Africa is not just expensive because doctors are a bunch of greedy,
Right.
I don't know, I don't want to use the word capitalists, but a bunch of just
Well,
exploitative...
the caricature of the capitalist,
Yeah.
you know, they all gather on the boardroom table and they've decided we're going to charge these prices.
Yeah, and I mean, that's simply not true. I mean, the amount of doctors in South Africa is controlled, firstly. So I think medical schools are limited by output. You're forced to get a 7-year degree. There are silly things like the National Health Act that basically tells private medical groups that they can't establish a hospital without jumping through various hoops. I mean, there's a whole list of, I think, 250 prescribed minimum benefits for medical schemes. That is basic things that they need to offer to everyone, regardless of their business model or something. And then, of course, the registration of medicine in South Africa also takes something like 6 years just to get through the first phase, even though the FDA in America has approved it already.
Yes.
And the European Union has approved it. We also need to approve it in our own process. This makes medicine and the medical profession generally extremely expensive. So dear listener, know that when you hand over that 1,000 rand to a doctor just for looking down your throat, that is government. That is not the doctor. He would charge you much less if he knew that would fill his waiting rooms. So that is the government is proposing to solve a problem it created, but it's gonna just exacerbate it if it employs the NHI.
It's the same sort of effect you talked about on a few episodes ago about the fuel price. You know, the percentage of that actually goes towards government bureaucracy and legislation, all these things, according to government interference. So I think, you know, it runs through these things. Once you can see the patterns, you can see it everywhere.
Before we end, I wanted to talk about briefly about some of the good things that Tito has been saying, in case people accuse us of being negative or something. But yeah, he has said some good things about selling SAA and doing some of those things. And he even, when he was in New York in front of investors, even talked about public sector wage bill and the need to reduce that. So what do you guys think are the likelihood or the prospects of him being able to push through some of those good things he said?
I hope that he walks the talk. Obviously, the talk sounds very good. When I first heard that he mentioned closing down SAA, I nearly jumped out of my chair. I got a shock. I was very excited. I think, he realizes that things are extremely tight and you can't keep funding these things ad infinitum. The taxpayer can only be squeezed so much until more and more people leave. So I don't know if they'll wait until after the election, maybe, if it's a, I don't know if it's a ploy necessarily, or if it just, I don't know, we tend to, we see the negative side, because if it is negative, it's going to have a big impact on us, so we need to, make the strongest possible argument.
Yeah. So the issue with what Tito has been saying is that there's one thing that unifies most of it, and that is that government is too big. And he has one major enemy if he is going to try and follow through with that, and those are the trade unions, and especially the specific trade union that's part of the governing alliance. And I mean, you're going to need a lot of backbone, political backbone, to follow through with what you're saying. I mean, the president has said this before. Various ministers, if you look, do a quick Google search, have said things like this in the past and in the recent past. But none of them, when push comes to shove, when they're facing down the unions, actually happen. So I'm pessimistic. But if there's perhaps a growing movement in government that says, listen, we're going to tell the unions that the country is going to fall apart if we don't disappoint you.
Yeah.
We are going to disappoint you, and then maybe you can come back stronger later. But for now, we need to disappoint you. We need that. I don't think we're going to get that. I hope we are.
So on that note, maybe we should end. And Martin, could you tell us their contact details?
Yeah, sure. So remember to always check the FMF's website at www.freemarketfoundation.com. Subscribe to this channel on YouTube where you're listening to this podcast. We are on Facebook. Search Free Market Foundation South Africa, or just in the URL, it's facebook.com/FMFSA. And then, of course, we're on Twitter, where you can also search Free Market Foundation, or you can search us at FMF South Africa, one word, and give us a follow there.
Perfect.
Thanks, Mpiagi. Congratulations.
Yeah, I've successfully hosted first episode.
We'll see. We'll wait to get feedback from the listeners.
Great. Yeah. All right. Cheers.
Sure.
Bye-bye.